गुड इवनिंग फ्रेंड्स। आज 10 मिनट लेट हो गए हैं। आई एम 10 मिनट लेट फॉर टुडे। Actually, I supposed to give you the guidance for the continuous guidance for the NEET PG 2023, and as you know that NEET PG 2023 is going to happen in the month of January 4th Sunday. The date I already have given you. Maybe you will get the notifications anytime, probably which I discussed, and I found is they will release the notification uh, during your counseling of NEET PG 2022. So during that time, they will release the notification for the NEET PG 2023 also, so that those uh, those who are at borderline and want to upgrade their choice, they can do, and they can take a call that whether they go for the counseling or they will wait for the 2023, which is going to happen in month of January. Now come to the guidance part. I have uploaded the link on my last video of the GIT part 2, the presentation which contains the liver part, mainly hepatology. And in that presentation you will find some very important uh, points which I have not covered in the questions, but that mentioned in the point. That means those scoring pattern to judge for the liver transplantation or other activities in the liver is very important for the INI-CET exam in the November. So those three scoring methods mentioned in the presentations, and you will get definitely a question in INICT November exam. I am saying definitely means definitely you will find that question in the INICT examination. So that has been mentioned in the presentation. When you will go through that presentation, you will find that what is the liver and all the basics covered, then pathology covered, pathophysiology covered, and how the alcoholic fatty liver disease develop, how the non-alcoholic fatty disease liver disease develops, what is the difference between NAFLD and AFLD. So that's very important, because in examination pressure time, you need to know whether it is a non-alcoholic or alcoholic if history is not clearly mentioned. In case of alcoholic, if they didn't mention the alcoholic but the findings suggest this is a case of alcoholic liver fatty cirrhosis, then you have to answer accordingly. I got this some suggestions from you people also, that in my previous question and from next onwards questions, what I'll do is when I'll post the answer from the urogenital system, I'll highlight the keywords in the questions, so that it will be better for you to get the understand of this questions. And now come to the urogenital system. It's a very important system, and you will find the links, both links for the GIT part 2 answers and the urogenital part 1 questions, uh, below in the description box after end of this video. Actually, I have posted a link that in my notice video, but unfortunately that link was not active, so I came directly live on that this one. So if you think why the urogenital system I took first immediately after the GIT, it's a very important, and it was reflected in your 2022 exam also. And urogenital system means this includes your kidney, ureter, urinary bladder, male genital system, and female genital system. And in female genital system, I try to cover the questions, starts questions of the obstetrics also, gynecology also, so that you will get a feel that these systems are integrated. And if you go through those questions, you will find that how the questions frames and how you must study. For example, we study pathology in silo, then we study pharmacology in silo. So we are not integrating it. But when you are studying the subject in silo, you, if you go on through these topics, then you will know that okay, this is important, that slides, how they will ask the pathology questions, because the system is changing, evolving. For the pathology, they will not give you a slide and ask that what is the pathological finding. They will show you the slide and they will ask the diagnosis. But for the pathology question, they won't show you the slide, but they will ask you, okay, these are the findings, these are the laboratory findings. So what, and you have taken the sample or biopsy or some other sample, what will be the microscopic finding? So in pathology questions, you won't see the particular slide, but in medicine question, you will see these slides, or in surgery question, you will see the pathological slides. So that's the integration. That's the integration of subjects. So in urogenital system part one, majority of the questions, rather I say almost all of the questions are clinically integrated questions. In part two, I will post the questions of paraclinical and preclinical subjects integration with the urogenital system. Important questions in the examination. So this these questions having 65 questions, and in next set probably 50 to 55 questions will be there in that also, and maybe more, I don't know, because I have not gone through that part of the question bank. So when I'll go through that question bank and I'll pick the question and I'll post those questions. And whatever questions I'm posting, those questions are of all standards, all toughness level, easy questions also, direct questions also, some questions in which you have to critically think. So all kind of integrated questions I have posted. So kindly go through those questions, and definitely you will be benefited from this in your, not only in the November exam but also in the 2023 January exams also. In last, for the 2022 candidates, please note, again I am reiterating, the 50% seats of the private medical colleges are coming to the at par with the government fees. Notifications issued in February, process is going on, the fees regulatory committees are working. So this is going to implement. Many questions raised in mail, many questions raised on the YouTube videos. And now I came to know that there was one RTI filed by one of you, and you got a positive response in that RTI. So, but you got the response now, which I was telling you since your examination. So don't worry, keep trust on you, relax. This is going to happen, and you will get good number of seats that will be beneficial for you. So this is a very short thing from you, and I will post the link uh, immediately after my live session, and I hope that you will get benefit from this. And if you face any difficulty in downloading from this link, so copy this link in your and paste it in your browser and open. It will be open, because I have kept property not only to the download, but if you want to edit, you can edit it. And if you want to make some other questions, you can make it on that sheet also. So I have opened it because I'm not a professional or a for you to charge, because as I mentioned very earlier, and I'm reiterating in my mails also, that I cannot charge anything from doctors. This is a medical ethics. This is against the ethics. So this is there. And whenever in the day or two, probably by the Saturday evening, I will post the presentation of the urogenital system, two presentations. uh, first presentation in this description box, and I'll try to get the second presentation also. And then when I'll post the answer of the first part, then I'll post the second part questions in a separate video along with the next system preset of questions. So this is all about the things today. And yes, postponement is not in the horizon right of now. Right of as of now, the dates are fixed for the January, and so you can go through on this one. And so prepare accordingly, so that you will have exam in November and January. And after that, when you will fully prepared, then go and crack your exam with the flying color. That's my wish to my friends who are connected to me. And thank you very much. And now I'll post the links immediately after the live session. Thank you.